Hello, my name is Erick Ballesteros, and today I will be discussing a devastating tragedy that occurred in Wittenoom, Western Australia, that involved a large asbestos mining company, thousands of asbestos miners, their families, and countless deaths as a result of mining chrysotillite, better known as blue asbestos. To provide a brief overview of what will be discussed in this presentation, first I would discuss the purpose and objectives. Next, I would discuss and provide context of the asbestos tragedy and discuss the global distribution of blue asbestos. Then I'll review data on asbestos-related disease effects on the population, followed by comparing mesothelioma rates and cumulative exposure levels. We'll then look at the increasing incidence rates for mesothelioma, and then we'll compare exposure and mortality profiles between Australian and Italian workers in Wittenoom. And we'll finish with a brief summary of the Wittenoom asbestos mining tragedy and its public health and economic implications. The Wittenoom asbestos mining tragedy is the story of a mining town in Western Australia where a company called the Colonial Sugar Refinery began mining chrysotillite, better known as blue asbestos, in the 1940s. A company town was built for over 20,000 workers and their families, but the mine was shut down in 1966 due to unprofitability and a rise in asbestos mining related health concerns. In total, about 7,000 men and women worked in the mines, and more than 2,000 workers and residents have died from asbestos-related diseases, namely the fatal mesothelioma. In this presentation, we'll compare the effects of cumulative asbestos exposure in workers and residents and explore its long-term impacts, and we'll review the health and economic implications of asbestos production and exposure. A striking fact is that Western Australia has one of the highest mesothelioma incidence rates in the world, at 4.9 cases per 100,000 people, according to the Australian Mesothelioma Registry, or AMR. Mesothelioma is a fatal disease, with the average time between diagnosis and death being around 11 months. As we can see in the figure on the left, Australia is listed as a country with a very high number of deaths related to mesothelioma. On the right here, you can see where Wittenoom is located in Western Australia. And the Australian government recently decided to remove Wittenoom's official status as a town and has even officially cut off all services and power to the area, even though 2 residents live there and refuse to leave. In total, about 28% of the miners have died, which is 2,000 of the 7,000 total workers. A study looked at a group of 6,489 men and 419 women who worked for the asbestos mining company between 1943 and 1966, and were followed up throughout Australia and Italy to the end of 2008. We can see on the left that there were many more deaths for the pleurotype of mesothelioma when the exposure level was less than 10 fibers per milliliter, followed by 10 to 50, and greater than 50 fibers per milliliter. The figure on the right shows the number of female mesothelioma cases by cumulative exposure levels, with all cases being of the pleurotype. This shows that the pleurotype, which affects the lungs and causes chest pain and fatigue, is much more common than the peritoneal type, which affects the abdomen and its related organs. However, the same study showed that mesothelioma rates significantly increase with greater cumulative exposure levels, with the highest incidence rates occurring at exposure levels greater than 50 fibers per milliliter for all types of mesothelioma cases. According to the Australian Mesothelioma Registry, we can see an increase in the incidence rate between 1982 and 2003 for both males and females, and this may be the case for a couple of reasons. Number one, because there is increased awareness and improvements in diagnosis, and second, asbestos was used extensively until the mid-1970s, and mesothelioma has a delayed onset of 20 to 30 years from exposure. We then see that the incidence rate has fluctuated between 2004 and 2018 and has since remained around 2.8 cases per 100,000 people in the population. One interesting point to make is that many workers migrated from Italy to work in the asbestos mines. Here we can see that for all mesothelioma types, Australian-born workers had a lower mortality rates than Italian-born workers. We can also see that Italians who stayed in Australia had higher mortality rates for all types of mesothelioma than Italians who returned to Italy. In summary, The vast number of asbestos-related deaths that occurred in Wittenoom as a result of mining blue asbestos was significant in terms of health and economic costs. Despite the fact that health concerns have prompted more than 50 countries to restrict or ban the use of asbestos since the early 1970s, others continue to mine and consume the toxic mineral in alarming quantities. Unfortunately, the unwavering support by aggressive industry campaigns has caused the popularity of asbestos to dramatically rise in developing countries, where affordable, mass-produced building materials are in high demand. Thank you so much for listening.